Hello guys, so this is the part 2 for infection control guideline. Yesterday we did the section A and now it's section B where there is a explanation given for the standard precautions that you need to follow for every patient. Okay, so first we will start with the hand hygiene. Under the hand hygiene topic, there are two things, which first one is the hand wash and the second one is the hand rub, which is the sanitization. You should know when to do hand washing and when to do hand rubbing or hand sanitization. Okay, then hand hygiene involves either the application of TGA approved hand wash or hand rub. Example, ABHR foam or solution to the surface of the hands, or the use of a liquid soap solution and water, followed by patting dry and the single-use linen or disposable paper towel. Okay, so according to the HHA protocol, your hands involves use of ABHR for clinical situation where hands are visibly clean. Okay, so when your hands are visibly clean, then you can just do the sanitization. Okay. The normal routine in a dental practice when no oral surgery is being undertaken should be for dental staff to use the ABHR, which is the sanitization between patient appointments and during interruption within the one appointment. For regular use, you need to apply the ABHR onto the dry hands and rub on for 15 to 20 seconds, and after which time the hands will be dry. For non-surgical dentistry, the advantage of ABHR are that it is efficient, taking approximately 15 to 20 seconds, does not require a sink with running water, detergents. So you all know the advantages of sanitization, that we do not require any water, detergent, or any paper towel. It will dry on its own. Okay, and when to perform hand hygiene, this is very important that you should know when to perform. Okay, so the hand hygiene, which is the hand sanitization, you need to perform it before touching the patient. Okay, and before a procedure, after a procedure, after touching the patient. So these four things are similar. You can try to remember that. And fifth point is after touching a patient's belonging. Whenever you use your hand for doing anything, even touching anything, just perform the hand hygiene to be on safer side. And then hand hygiene must be undertaken before and after contact with every patient. Before gloves are put on, you need to sanitize your hands with the gloves. The hand sanitization is very commonly involved. You need to do before putting the gloves on and after donning and doffing of the gloves. There is a hand sanitization. Okay, and if handshaking occurs either at the start or an end of the appointment, it may increase the risk of transmission. The risk can be mitigated by undertaking additional hand hygiene after shaking hands. Practitioners should not shake a patient's hand when greeting them without having first completed hand hygiene. Okay, then how to apply ABHR? You should know how to apply it. When using hand gel dispenser, apply enough gel for at least 20 seconds of rubbing, which is about the same time as singing happy birthday song twice. Then follow the instruction for use in regards to the quantity of gel to be used, usually 1 to 2 squirts. Ensure that there is sufficient gel to remain on the hands for at least 20 seconds. So the hand hygiene should, or the hand sanitization should be done for 20 seconds. If there is no gel left on the hands after rubbing for only 10 seconds, then add additional gel. So your gel should be enough that you can sanitize your hands for at least 20 seconds. Only apply gel to dry hands. If you will apply the gel to the as water remaining on the hands after hand washing dilutes the product, thus decreasing its effectiveness. So always hand sanitization happen on the dry hands. Then how to select an appropriate ABHR product? How you can do the testing that is this product good to use in dental setting or not? So the best thing is that the product meets the EN 1500 testing standards for the bactericidal effect, and it should be approved by the TGA. Okay, and a range of ABHR products are registered with the TGA and are listed in the Australian Registered Therapeutic Goods. The listing will normally be indicated on the product label, and you could find out. And these are available as gel, liquids, or foam basis. For staff whose selection and use of an ABHR product may be influenced by religious factor, it is important to know that using hand gel does not result in any significant alcohol absorption through the skin, and thus using hand gel in the clinic does not breach a prohibition around alcohol. Because some people, they do have some religious belief that they cannot take the alcohol in their body, and so they think that doing the hand sanitization can lead to um, the alcohol intake in their body, but that is not the case. Then choose an ABHR product that suits the skin type of the staff, and when the correct product is chosen, the emollient agents in the gel will prevent the skin from becoming dry. So when you will, like they have written here, within one appointment you need to do, like so many times you need to do the sanitization, right? So that can make your hands go dry. So that's the reason there is an agent which is mixed in the gel that would help and preventing your hands to be dry or irritated. Okay, then all right, and there are specific high potency ABHR that are mainly used for the surgical scrubs, such as if you plan to do any implant procedure. Before that, the high potency ABHR are generally used. Okay, so they have higher concentration of ethanol or isopropanol and are tested using more stringent performance test. Okay, and they have certain different like timing, which is the 90 seconds, and yeah, certain difficult like different from the normal hand sanitizer that we commonly use in the dental setting. Then where should you place the hand gel dispenser? It should be placed away from children to prevent accidental ingestion, and avoid having hand gel dispenser located at the hand washing sink, because there might be any confusion, and if you use the hand sanitization as thinking of soap, then it won't work, right? And keep bulk supplies in the clean area. And it is as it does contain alcohol, which is the ethanol in it, so it keep it away from any source of high temperature or ignition, such as open flames. All right, and bottles of ABHR should not be topped up. You cannot top up one bottle if it is empty. You cannot top up it. You because the outer side may be contaminated. You should buy a new one. Okay. Then use of moisturizer is often required because your hands may get dirty. Sorry, may get dry. And now they have written here, when is hand washing required? So hand sanitization was required at many instances, even between the patient and even in the single appointment on these moments. But when you need to do the hand washing? At the start of the working session, at the end of a session, and after toilet breaks, and whenever they are visibly dirty, because for the hand sanitization we know we can only perform the hand sanitization when the hands are not visibly dirty and contaminated with proteinaceous material or visibly soiled with blood or body fluids. Washing hands with liquid soap and water is preferred in each of these solution situations due to the mechanical removal effect. Okay, then you need to hand washing should be undertaken in dedicated sink. You need to know like where you can do the hand washing in the dedicated sink in the clean zone only. Okay, these sinks should have the taps which are non-touch, or you should operate it by the use of foot pedal or even with the help of a paper towel. If conventional taps are used, they should be operated with the use of a paper towel rather than bare hands. Hand washing must not be undertaken using the sink in the contaminated zone. So the hand washing should be done in the clean zone only, and with the preferably with the non-touch tap. Hand washing after an ABHR is required when dental practitioners work outside the normal clinical setting. Example, in a nursing home or a patient's home, then even they may need to do the hand sanitization and the hand washing regularly. But in the dental clinic, the washing is generally only required at the start of the session. It means whenever you are entering the room and exiting from the room, then you need to start do the hand washing, and after the toilet breaks, and if your hands are dirty. This is very important thing that you should know when to hand wash and when to hand sanitize. Then hand washing rather than an all right, this is we have done. Then do not put hand gel dispensers in the toilet area. Alcohols have limited activity against non enveloped viruses such as those linked to highly contagious gastrointestinal infection. So you should also know the different steps of the hand washing. Okay, and the tap should be non-touch tap, and it should be done in the sink which is located in the clean zone. Then hand care. For the hand care, you should use well cared. The hands should must be well cared for, because intact skin is a first line defense mechanism against infection. If the skin is damaged, then it could lead to infections in the host and can harbor higher number of microorganisms than intact skin. Damaged skin in dental practitioners and clinical support staff is an important issue because of the high frequency of dry, itchy skin. Among these staff, from irritant contact dermatitis, it is caused most often by frequent and repeated use of hand washing. Because in the COVID timing as well, whenever we guys were working, so we need to do the hand. We was doing sorry we were doing the hand washing and the hand sanitization more often than we normally do. So in that time the hands were really dirty, so you need to take care of your hands. Okay, and do not use poor quality towels. They can abrade your skin. And do not use any product that contains fragrances. Okay, because that can lead to dermatitis. And do not don the gloves while your hands are still wet, or use hot water for hand washing. Okay, and always try to do more and more moisturizing. That would help with the betterment of your hands. Then appropriate preparation of the hands and wrist bare below the elbow. So this is a rule that whenever you are working in the clinic, you should be bare below the elbow. There should not be any jewelry, like in line with the National Hand Hygiene Initiative. All hands, wrist or nail jewelry, including all rings, okay, and bangles and bracelets, watches and wearable devices such as Fitbits must be removed by clinical staff prior to putting on gloves. So there should be nothing below the elbow, bare below the elbow. Okay, because that could be a source of where the bacteria can lodge and can lead to some infection transfer. Areas of skin beneath rings on the fingers must become much more heavily colonized with microorganisms than adjacent areas, and wearing rings increases the carriage rate of gram-negative bacteria on the hands of clinical staff. This is why rings should be removed. Then each dental practice needs a clear policy statement with its infection control and infection prevention and control manual regarding the need for clinical staff. So you should make sure that your staff understand, and they should not wear nail polish, artificial fingernails, fingernail extension. So nothing of these things are permissible, and the law of or the rule of bare below the elbow should be followed, because otherwise these things can act as a source of transport for the medium for the microorganism and can be very dangerous. All right. And the second point, so the hand hygiene is done here. Second is the personal protective equipment, which does include the gloves. Okay. And then gloves, then you need to select the so they have given like so much more discussion about this, but you can read it. It is not very important topic. Okay, so you should wear the gloves. The gloves can be made from the latex or the non-latex. Okay, so if you have any allergy, then do not use latex glove. And if there is any tear or pin pricks in the glove, then you should take your glove off and sanitize your hands and put on the new glove. And you should know the size of your gloves. Glove selection should be good, because either if you are wearing the smaller or the larger size, it won't create the better seal, and it would not be like very good for the compliance. Then where you can place the glove boxes, it should be the accessible is important. And since many dental procedures require planned changes of gloves during the procedures of a chairside assistant, this is an additional and this is in addition to unplanned interruptions. So the opened and unopened boxes of gloves must be stored away from the splashes of fluid from patient care. Open glove boxes need to be kept away from the direction. So you need to keep it in the clean zone but away from the patient splashes so that they won't get dirty, which would be the separation distance of at least 1 meter sideways from the patient's mouth should be implemented to prevent the splashes of the material reaching the boxes. Okay, and the mask is essential item of PPE. You should wear your mask, and it should be the fit should be proper. That would only help you in preventing the spread of the or block the entry of 95% of microorganism. And with the filtration ability of a mask begin to decline significantly after 20 minutes because of the moisture on the inner and the outer surface of the mask. After this time, the performance reduces progressively. So if the mask has become completely wet through from within and from outside, as well as at the end of long procedure, a mask has become significantly less effective and should be replaced with the new mask. To provide effective filtration, it is critical that the mask is fitted closely. Fit is very important, and by adapting the mask to the nose bridge piece and the sides to reduce leakage of air. Okay, and the design of mask influences how well it can be adapted to the face of the wearer. And ear loop masks tend to gape at the sides, which allows greater leakage of air compared to the surgical mask. So surgical masks are better than the ear loop mask because they fit properly and there is no allowance for the air to enter. Okay, and any procedure using a powered dental handpiece, irrigation, or a triplex syringe requires the use of a mask with at least level 2 splash protection. So certain masks have certain protection, like some have high level of protection, like the level 2, level 3 protection. So they are different strategies. And the whenever you are using the triplex, which is the most common thing, you would be using it, so the your mask should comply with the level 2 splash protection. Okay, and most masks have reduced filtration performance for particle ranging from zero point 0.1 to zero point 0.3 microns in size, which is diameter for human influenza virus, which is the most deadly and most contagious virus. Then they have like written here, masks must and must not. It should not be touched by the hands, be lower to expose the nose, be worn for extended period, like not more than 2 hours, and be more around the neck. So you can only wear the mask around the bridge of your nose, and it should be tightly fitted, and it should never be for more than 2 hours. Then eye protection, it is also important, even the eye protection of the patient, eye protection of the dental nurse, and your eye protection as well, because there are certain procedures that can increase the chances of aerosols, splattering, or spraying the blood, saliva, and body substances, and that can lead to a medium of transport of a microorganism and can penetrate the eyes. Okay, so it is very important, and the eyewear must be optically clear, anti-fog, distortion-free, and close-fitting. It is essential that eyewear be shielded at the sides. It is very, very important. And the prescription lenses worn for vision correction are not as suitable for protective eyewear, because corrective spectacles in regular frames do not have sight protection. Most designs do not cover the orbit fully, and thus they will not provide the wearer from they will not protect the wearer from the splashes of material or projectiles. All right, so wearing the eyewear is also very important, and both staff and patient use a protective eyewear that protects the orbit fully and has side protection. Regular corrective spectacles worn by the staff are not used as a substitute, and eyewear worn by clinical staff is decontaminated between the patient. So you should decontaminate it with the chemical, okay, that the wipes you will be using to clean the dental chair or the dental setup. You should also clean the eyewear as well. Reusable eyewear for patient is treated as a non-critical item, and it should also be cleaned with the detergent. Then protective clothing, which is the your scrubs, you should be a key concept is that of layering, so that street clothes worn underneath do not become contaminated. So if you are wearing any top under these scrubs, that's fine, but there should always be these scrubs that you should be wearing in the dental setting. And at the time of your lunch break, you should remove this scrub because it is dirty, and this is the thing that they do follow the layering technique. And it should be bare below the elbow, so it should be mainly the half sleeve. And for the footwears as well, your footwears should be enclosed, that will protect them from injury or contact with the sharp object. There is one case in Odell as well where there is a like case name is ouch, where there is injury from the luxators which you were using on the patient who is hepatitis B positive or HIV positive. Okay, so your footwear should be ankylosed and they should protect you from injury or contact with the sharp object. Then surgical procedures and surgical aseptic techniques. So this is mainly for the procedures that do require the surgical procedures. Okay, and for them you need to use the surgical hand hygiene and wear the surgical scrubbing and okay, so there is certain different laws for that. Staff perform surgical hand preparation and wear sterile glove. Staff wears an appropriate gown and hair is controlled. There is a defined working field and with sterile drapes. Any irrigation solution used are sterile. So these are mainly for like, for example, implant surgery or any surgery that you might be performing. But according to the Australian Dental Council exam, they just consider you as a newly qualified dentist. So in from the exam point of view, these things are not very important because you won't be doing the implant surgery in the patient like just straight away. Okay, but you should know that there is a separate strategies that you need to follow and more aggressive infection control. Then management of sharp. It is very, very important. You should know how and where to dispose the sharp waste. Okay, so we will continue from this topic from tomorrow. All right, thank you so much, guys, for watching, and continue like, share, and subscribe.